A base tan protects against sunburn. In fact, any tan is a sign of skin damage. It does not prevent further harm or skin cancer. Have you ever wondered what happens when you get out in the sun? The sun gives off energy called ultraviolet or UV rays. We can't see UV rays, but they can still affect us. There are three types: UVA, UVB, and UVC. UVC doesn't reach us, but UVA and UVB does. Even on cloudy days or when you're near a window, UV rays can reach you. UV rays don't just come from the sun, tanning beds and some lamps give them off too. So what can UV rays do to us? Initially, too much UV exposure can hurt our skin and eyes. Long-term effects include premature aging, skin cancer, and eye disease. Knowing about UV rays is the first step towards keeping yourself safe. Watch to the end to understand the health risks of UV exposure and how to protect yourself and your family. 1. Short-term overexposure to UV rays causes sunburn. Red, painful, and sometimes blistering skin. We've all been there. Sunburn is an inflammatory response, and repeated episodes, especially in childhood, increase the risk of skin cancer later in life. 2. Premature aging or photoaging. Chronic UV exposure breaks down collagen and elastin fibers in the skin, leading to wrinkles, sagging, leathery texture, and uneven pigmentation, such as freckles, age spots, and dark patches. These effects may not be visible until later in life, but add up over years of sun exposure. This photo is a famous one I remember from residency. This poor guy, I think, was a truck driver, and half his face was always exposed to the outside world, and the other half was on the inside of the cab. And as he's driving around all day, every day, for 20 some odd years or 30 years of his career, one half of his face got a lot more sun exposure. And you can see the difference between the side that was inside the cab not getting direct UV light and the side that was constantly getting sunshine coming in and hitting his face. It's dramatically aged. 3. Skin cancer. UV radiation damages the DNA in skin cells, causing mutations that can lead to cancer. There are 3 types of skin cancer linked to UV exposure: basal cell carcinoma and squamous cell carcinoma, which are non-melanoma skin cancers. These types often develop on sun-exposed areas and are the most common skin cancers. Spots that people don't often think to protect are the ears, the lips, and the backs of your hands. Melanoma is the most dangerous form of skin cancer. It's responsible for most skin cancer deaths. Risk increases with intense, intermittent sun exposure and severe sunburns, especially during childhood. UV exposure can cause other skin damage like actinic keratosis, which is rough, scaly patches, solar elastosis, which is thickened, yellowish skin, and increased bruising or slower healing due to weakened skin structure. They say that your eyes are the windows into your soul. While that is very charming, our vision is probably our most critical sense and needs to be protected. Every solar eclipse we're warned to not look at the sun directly. Our eyes are very sensitive to UV radiation. Here's a breakdown of the eye issues that can develop. Photokeratitis, which is known as sunburn of the eye. This painful condition can result from intense short-term UV exposure. Symptoms include redness, tearing, pain, and sensitivity to light. It's usually temporary but can be very uncomfortable. Long-term UV exposure can make the lens in your eye cloudy, which is called a cataract. Cataracts can make it hard to see and may need surgery to fix. UV rays also contribute to age-related macular degeneration, which is the most common cause of vision loss in older adults. This condition damages the central part of the retina, which is the part of your eye that gives you sharp central vision. My patients who've had this issue literally can only see kind of with their peripheral vision because the central area is so blocked. UV can also cause growths on the white part of your eye, which is called a pterygium, skin cancer on your eyelids, and damage to the skin around your eyes, which can make us all look a lot older than we actually are. UV radiation can weaken the skin's immune defenses. This makes it harder for the body to detect and repair early skin cancers or infections. It does this by altering the function of immune cells in the skin, such as Langerhans cells, and by triggering the release of immunosuppressive molecules. This suppression can be local, just in the exposed area, or systemic, affecting the entire body. UV exposure can aggravate diseases like rosacea, eczema, or herpes simplex, leading to more frequent or severe outbreaks. For a lot of my patients with fever blisters, I always give them extra medications because during the summer, when they go to the beach, they'll have more breakouts than normal. For my lupus patients, they are always worried about what they're wearing because if they get a lot of sun exposure, they'll get that malar rash on their cheeks and it can be really frustrating to deal with. Some medical conditions like lupus and medications like tetracyclines or diuretics can increase sensitivity to UV rays. This makes individuals more prone to burns, rashes, or flare-ups of their underlying illness. As with everything these days, there's a lot of misinformation out there. Many patients hold incorrect beliefs about UV exposure and sun protection, which can increase their risk. Here are the most common myths I hear about UV exposure. Cloudy days are safe from UV rays. Fact, up to 90% of UV rays penetrate clouds. Sun protection is needed even on overcast days. Tanning beds are safer than sunbathing. Fact, tanning beds emit concentrated UV rays and significantly increase cancer risk. People with darker skin don't need sun protection. Fact, all skin types can get UV damage and skin cancer. Darker skin may delay diagnosis. Makeup or moisturizer with SPF is enough. Fact, most cosmetics offer insufficient protection. Broad spectrum SPF 30+ is recommended. Sunglasses are only needed in summer. Fact, UV rays can damage eyes year-round regardless of season or weather. All sunglasses provide UV protection. Fact, only sunglasses labeled as 100% UV protection or UV 400 block harmful rays. Darker sunglass lenses mean better UV protection. Fact, lens darkness does not correlate with UV protection. Look for verified UV blocking labels that we just mentioned. Shade provides complete protection. Fact, UV rays reflect off surfaces and can reach skin even in the shade. Sunscreen is only needed during peak hours. Fact, UV exposure occurs all day long. Protection is important from sunrise to sunset. There are several situations that dramatically increase UV exposure. Let's go through each of them so you know when to be extra vigilant. Water. Swimming pools, lakes, and oceans can reflect up to 10 to 20% of the UV rays. Snow and ice reflects up to 80% of UV rays, making sunburn possible even in cold weather. Beaches can reflect about 15 to 25% of UV rays. Concrete and pavement. These can also reflect a significant amount of UV radiation. Higher altitudes mean higher UV exposure. With every 3,000 foot increase in elevation, UV levels rise by about 10%. This happens because the atmosphere is thinner at higher elevations, so less UV radiation is filtered out before reaching your skin. Summer brings stronger UV radiation. UV levels are highest during the spring and summer, but can still be significant at other times of the year, especially in sunny climates like Phoenix. Midday sun is the most intense. UV radiation peaks between 10 a.m. and 4 p.m. when the sun is highest in the sky. Clouds don't block all UV rays. Up to 90% of UV rays can pass right on through light clouds, so you can still get sunburned on overcast days, even though it feels like it's safe to go outside. Cool or windy weather can also be misleading. You may not feel hot, but UV rays are still present and can damage your skin. Your risk of UV exposure increases with altitude, proximity to the equator, time of day, season, presence of reflective surfaces, and certain weather conditions. Personal habits and the amount of skin you expose also play a major role. Understanding these factors helps you take smart steps to protect your skin and eyes year-round. Taking steps to protect yourself from UV rays is essential for keeping your skin, eyes, and overall health safe. Here are the steps I think you should take today. Use sunscreen. When I was in high school, Baz Luhrmann released the song, "Everybody's free to wear sunscreen." Aside from the great life advice, the take-home message was just to put it on. Here are my suggestions to best use sunscreen. Choose broad spectrum sunscreen. Look for broad spectrum on the label, which means it protects against both UVA and UVB rays. Only use sunscreen with an SPF rating of 30 or more. Higher SPFs offer more protection, but no sunscreen blocks 100% of UV rays. Apply generously. Use about a shot glass or 1 ounce for your whole body. Don't forget often missed spots like the ears, the back of the neck, the tops of the feet, and backs of hands. Reapply every 2 hours and immediately after swimming, sweating, or towel drying, even if the sunscreen is labeled water resistant. Next up is lip balm. Lips are vulnerable to sunburn and skin cancer, as every skier will tell you. Use a lip balm with at least SPF 15 and reapply it regularly, especially after eating or drinking. Wear protective clothing. They will save you from having to reapply sunscreen all over your body regularly and are less messy. Long sleeve shirts and pants specifically labeled with a UPF or ultraviolet protection factor rating are great. If you're going somewhere warm, you can find clothes that are loose fitting and light to make it comfortable. Dark colors absorb more UV than lighter shades, offering even better protection. Next, find a good wide brim hat. A hat with a 2 to 3 inch brim all around protects your face ears, and neck better than a baseball cap. And lastly, find sunglasses with UV protection. Make sure you use sunglasses that block 100% of UVA and UVB rays. Wraparound style offers the best coverage. You can check out the video description for links to really good products that I use and recommend. More time spent outside just means more exposure. While I think it's great to spend a lot of time outside, there are some adjustments you can make to mitigate the risk. Avoid peak sun hours. The sun's rays are the strongest between 10 a.m. and 4 p.m., so try and stay indoors or in the shade during these hours. I don't let my kids go swimming in Phoenix until after 5 o'clock. Use umbrellas or shelters. When outdoors, use umbrellas, trees, or canopies to reduce direct sun exposure. We finally invested in a pop-up sunshade, and it's made all the difference on beach trips and during the kids' sporting events. Remember, reflective surfaces means extra protection is needed. Use additional sun protection when you're around water, sand, snow, or concrete, as these surfaces reflect UV rays and increase your risk. Monitor the daily ultraviolet levels. The UV index, available on most weather apps, tells you how strong the UV rays are each day. Take extra precautions when the index is high or you plan to be outside for an extended period. Protecting yourself from UV rays is important, but sometimes, even with the best precautions, problems can still occur. Knowing when to get medical help can make a big difference in your health and recovery. Here's when you should reach out to a healthcare provider. Sunburns that are really severe or unusual should prompt an evaluation. Here are the symptoms I personally would watch out for. Blistering. If your sunburn causes large blisters or covers a large area of your body. Severe pain or swelling. When pain is intense or swelling is significant and doesn't improve with home care. Signs of infection. Look for increased redness, warmth, or pus, or red streaks coming from the burn. Fever, chills, or nausea. If you feel sick, develop a high fever, or experience vomiting after a sunburn, these are all serious signs. Another issue to watch for is skin changes that just don't heal. Any mole or spot that changes in size, shape, color, or texture is a concern. Sore or bump that doesn't heal after several weeks or keeps bleeding or crusting. Any new lump, bump, or patch that looks different from the rest of your skin. It's important to get an annual skin checkup with a good dermatologist. Eyes are very sensitive, and things I worry about include eye pain or vision changes. If you experience pain, blurry vision, sensitivity to light, or see spots or flashes after sun exposure, you need to get checked out. Any redness or swelling in your eyes that doesn't get better within a day or two is also not normal. Flare-ups could be a sign of worsening health. If you have a condition like lupus or take medications that increase sun sensitivity, contact your doctor if you notice new or worsening rashes, joint pain, or other symptoms after sun exposure. Thank you for watching this far. Let's put everything you just learned together. UV rays are invisible but powerful, reaching us from the sun, tanning beds, and even through clouds or windows. Both UVA and UVB rays can cause harm to your skin and eyes, whether it's sunny or overcast. UV damage isn't limited to your skin. It can damage your eyes and suppress your immune system. Many myths persist, like thinking you're safe on cloudy days or that a base tan protects you. In reality, UV rays are present year-round and can reflect off water, sand, snow, and pavement, increasing your risk. Smart protection means using broad-spectrum sunscreen like SPF 30+, reapplying often, wearing protective clothing, hats, sunglasses, and SPF lip balm, and seeking shade, especially during peak hours. Monitor the UV index and be extra cautious at high altitudes or near reflective surfaces. Most importantly, encourage sun-safe habits from an early age. Teaching kids and teens to protect their skin and eyes sets them up for lifelong health. If you notice severe sunburn, skin changes, or eye symptoms, seek medical advice promptly. If you need help coordinating care or want more support, you're welcome to join my practice at Bespoke Concierge MD. If you found this helpful, like, subscribe, and share with somebody who needs to be better prepared for the effects of UV rays.